we looked at patients through different stages. So we looked at patients at the time of diagnosis, and what we found was at the time of diagnosis was patients were fairly dependent on their healthcare providers. They were go and wanted to get the treatment done. There were not a lot of options, and I think that is pretty straightforward when you think about multiple myeloma. When it comes to newly diagnosed patients, we know we give them a triplet, and we don't necessarily talk about toxicity as much because you want that efficacy, you want them to feel better, and that's something which actually did pan out in this study. When it comes to second, third line, fourth line treatment, there was a little bit of a difference, and the difference here was there was a lot more discussion on toxicity, and there were a lot more choices, and that's pretty much what we see in the field as well, because you put not just patients, but you put 5 myeloma experts in a room, you're not going to get the same uniform answer as to this is how I would treat my patient. And I think we saw that in this sort of patient-related outcomes study. We saw that they did focus a little more on toxicity, and they were given more choices as opposed to the frontline setting. So we do see differences, and I think these differences are largely because of the fact that we do have choices that if we just had the one drug, we would not have this discussion. But the good news is in myeloma, we have multiple different treatment options that we can offer, and patients are engaging in that kind of a conversation.